We are very familiar with intragastric balloons and how they are a minimally effective endoscopic weight loss technique widely proven in hundreds, maybe thousands of papers throughout the world. Today, we'll be focusing on adjustable balloons, and there comes one of our main characters of this story, the SPOTS 3 adjustable balloon, so far the only device with the adjustability feature. That means, of course, we can play around with its volume by performing either downward or upward adjustments whenever it's needed by patient or doctor's demand. It only requires a simple endoscopy and voila, the balloon adapts to one's necessity. Let's also remember that SPOTS 3 can be used for a 12-month period, allowing both doctors and patients to come with better results. That means the patients had an extra time to embrace dieting modifications and beginning exercising in some effective way. A larger or smaller balloon provides us many advantages when comparing to a traditional balloon. Let's think. There are some situations in which a harder adaptation is expected. For instance, second balloon placements, low-statured patients, and those who had an abdominoplasty before. We can mitigate those foreseen intolerances by beginning our treatment with a small volume and after 3 to 4 weeks increase the device to the volume we would have started with. Another not so common but crucial situation corresponds to those 4 to 5% of the patients that presents an extended period of adaptation. Many of them suffered a lot, and despite the medical efforts to terminate treatment by asking for an early balloon removal. That causes frustration and even anger. Using an adjustable balloon allows you to retrieve some of the liquid, turning the device into a flat tire, leaving 350 to 400 milliliters so that the balloon does not migrate to the small bowel, and buying time for the organism to adapt, and voila, after 3 to 4 weeks you can increase the volume. Finally, we can evaluate adjustability by trying to escape weight loss plateau. The amount of volume is still a discussion among us doctors, especially because we have seen in previous studies that the greater the volume, the higher the chances of developing gastric ulcers. This has been an important conclusion in a study that analyzed 487 patients submitted to SPOTS 3 balloon implantation performed by our group in association with Endogastro Rio, Health Me Clinic, and Uzui Clinic, presented on 2018 DDW. Possibly the pressure applied to the stretcher tube, heavier due to the higher volume, causes extreme compression to the gastric mucosa and leads to ulcers. Regarding the 12-month treatment, we know for sure that most of the weight loss occurs on the first 6 months after the implant, but 29% of the percentage total body weight loss is seen on the remaining months. That is another thumbs up to a larger therapeutic window. Now I'm going to introduce the second character of our study, the GLP-1 analog liraglutide. The idea of associating meds to an endoscopic device is to boost weight loss results and to dodge our feared gastric ulcers, but some doctors are afraid of the gastroparesis effect caused by both tools, leading to extreme nausea and vomiting. GLP-1 analogs enhances insulin release in a glucose-dependent manner. It suppresses glucagon secretion and reduces gastric motility, promoting early satiety. Liraglutide is a drug that requires a daily injection, although subcutaneous. Let's remember that liraglutide can be used in diabetic patients or not, and also on those suffering from cardiovascular diseases. So now I move on a bit forward to present our objectives. To evaluate the efficacy of combined therapies in patients undergoing multidisciplinary weight loss treatment, a research was conducted comparing the results of the intragastric adjustable balloons in different situations. The study considered 4 arms representing distinct groups of patients. When we increase the volume, there is a higher incidence of gastric ulcers due to its weight, as mentioned before. However, can liraglutide use provide a great weight loss and avoid gastric ulcers due to the upward adjustment? Is the upward adjustment worth the risk? From December 2016 to December 2017, 159 patients who completed the treatment with the 12-month SPOTS-3 balloon were analyzed. The mean age and the percentage of women is over there. The results showed the percentage of total body weight loss, percentage of excess weight loss, and difference in body mass index at the beginning and at the end of treatment. So let's point out some things. Upward adjustments were performed at the middle of treatment with 200 cc's of saline and were voluntary. It's up to the patient to undergo the procedure. Look at the up group. They show the worst results, and we have two theories. Either they were naturally bad responders due to slow gastric emptying like Dr. Gontran showed us before, or they are cheaters and they have this nibbling behavior and they eat lots of calories. And so they come to the adjustment as if it is a miracle. Maybe it can be a rescue. They talk to the team and they can be back on the right track. But as you look at the LG up group, you deduce that either naturally bad responders and or nibblers will respond to Saxenda, and this explains the success in this group. Let's also remember that we've had 3 gastric ulcers among the up group, 3 out of 53, and 1 in the LG up group, 1 out of 34. That emphasizes what we said before: the greater the volume, the higher the chances of developing a gastric ulcer. Last but not least, costs. Using the average dose of liraglutide, patients would have an extra 150 euros cost a month. But we accept hypertension and diabetes being a chronic disease. Why not obesity? Shouldn't it be worth the cost? To be able to boost weight loss or to rescue bad responders is a unique thing. I have patients using Saxenda for over 2 years without meaningful effects. Don't be afraid to prescribe.